how can we support our partners and families after we've had a cancer diagnosis? For example, all the various stages that might lead on after that.
Well, just as I'll say to a patient, grief is a natural response to any loss. So there will be a natural grieving process that will go on for whatever the losses are, whether it's a loss due to surgery or a loss of control, all the experiences that you would have had. But also, so will those people that love you. All those people will be going through a grieving process too, and it will be all at different times. So what I would say is try and talk with each other. Sometimes when people are more avoidant and they're not comfortable with their feelings in everyday life, it doesn't mean it's wrong, but it's how they are perhaps as a family. Anger and irritability might be at the forefront, and sometimes that can cause problems in relationships as well, and be misconstrued. People will make assumptions. But so it can cause problems as well. So I would say is talk it through.
You talk about the fact that people grieve after a cancer diagnosis. What kind of feelings are involved in grief? What kind of things come up?
Well, I suppose if we went back to the diagnosis in the beginning, shock. And another way of putting that is nature's anaesthetic. It's a way of our bodies keeping us away, or our minds keeping away from big feelings for a while. And then quickly into the hospital, the focus is on treatment. So sometimes there's a delayed reaction. The emotional fallout happens a bit later on, and often that can be at end of treatment. Not always. Sometimes it's during treatment, but at end of treatment and a bit after. So sometimes patients will expect to feel elated at end of treatment, or even back to some sort of normality, and feel disappointed when they're not. And that's a time when the big feelings can come in, the emotional acknowledgement. Fear, anger, guilt, sadness, search for meaning. All of those things can come up, or some of them. And people can feel very kind of thrown at how they do feel and feel like they're going backwards. But it isn't going backwards. It's just another part of this experience. And unfortunately, there's no sidestepping grief. For anything, for adjusting to a life that is different, we have to grieve for what we've lost. There's no sidestepping that. So by working through those feelings, it won't feel comfortable, and you may need to visit them many times, but each time you do, eventually they become less overwhelming and raw. And that can go for any stage of illness, really, whether it's for after you're hoping for a cure, or if someone's been given more news, they might get back on that wheel again. And as I said, there's no sidestepping grief, but by working through it, although obviously nobody would want to accept that this has happened, but I like to call it an adjustment.
Right.
And even with people that are at a later stage in illness, can actually come to a different place, a readjustment. And just as people will have renewed hope, it might be reframing hope, maybe not hoping for a cure anymore, but reframing what they hope for.
Right.
So it's a very important process. And with partners and family and friends,
Right.
they all may be doing that a bit differently. So it's talking, keeping the lines of communication open if you can.
Sure. So that grief process, that model, I suppose, is very clearly defined then.
Yes, it is. And it's all lovely. It looks very neat, actually, if you look at it. But actually, it's a little bit muddy, so you can merge backwards and forwards a bit, and you think you kind of come out of one, and you might slip back into a bit of shock, and you might find yourself, gosh, I've had cancer. And it might feel like a shock, new news. But, so it's not a tidy experience, but a very important part of this experience.
Right.
And it's part of the healing. Recovery is a process, not an event. So all I would say is be kind to yourselves and, allow that to happen.